Welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, and we're here today with Phil Isco. And Phil is a counselor in our Family Development Program, and this is a program that we've really just brought on board within the last year or so, and we're getting a tremendous amount of support for this program. A lot of people are really seeing value in it. Give us a sense of what this program does.
Well, right now, what we're offering is it's a family programming. It's a series of groups that are held at night or on Saturday afternoon that are open to all families and clients of the agency in any level of care. And what it provides is sort of, the disease model of addiction and sort of explaining a lot of what the individual that is a client is going through when they're into treatment, as well as kind of providing some of the details as, this is what it is like to be an individual with an addiction. And these are kinds of things that you can expect to see. Here's some knowledge that's going to help both you as a family unit and as an individual kind of adjust to this process that, is pretty tumultuous with the changes that someone will go through when they are getting clean and when they are starting other processes.
Now, what's the relationship between this program and, let's say, Al-Anon? And I'm hoping that, a lot of these folks end up getting more involved in Al-Anon.
Absolutely, and that's one of the things that we definitely push, in these groups and in this process is, our programming is good and we're offering a lot of help here. And there's also this entire support network, much like the individual going through treatment is going to have to do. They have to go to AA or NA meetings. There's meetings for you too, and there's, you're going to be able to surround yourself with individuals that have been through similar experiences and are going to be able to help you. As far as the similarities between the two, we do a lot of work with sort of being able to kind of detach from certain situations and a lot of focus on self-growth, personal growth, as well as familial growth, which is a lot of what they're going to get out of it now.
And we know now also that for our clients, their chance of success long-term really is dependent upon the kind of support they get from their families.
Exponentially. Developing a positive support group, especially with close family members, is unbelievably important. Being able to, leave, or sort of go through the relative safety, I should say, of something like treatment and being able to go into an environment that's also secure and stable, it's really extremely important. One of the problems we may see sometimes is someone who has gone through treatment and gone back into an environment that isn't maybe necessarily as stable as it should be, which can be fairly triggering for an individual.
So for a family member, what do I need to know? So before I can be of the best value and the best support for my loved one who's going through treatment, what do I need to know in order to be that support?
Well, there's actually a lot of things, kind of like almost a jumping off point of where you can start. And a lot of the initial stages of sort of that change are dealing with a lot of the anger, a lot of the hurt, a lot of the pain, a lot of the frustration. Those feelings are all going to be present, and they're fairly normal in that situation. So getting some of those basic, I should say, skills to be able to effectively deal with the stress, deal with the anger, deal with the resentments, deal with loss of money, all the things.
And some of those feelings they're going to stay for quite a long time, aren't they?
Certainly. And acknowledging the fact that they're there is probably, just kind of like step one. Acknowledging the fact that they're present and that they're normal is the best way to go. And just because you do recognize them doesn't mean they're going to go away immediately.
Right.
It's learning how to deal with them and then form new relationships as it goes on. Yes, these things have occurred. Yes, they're horrible. And I promise you're probably frustrated. But being able to sort of grow with the individual that's going into treatment and growing as a unit versus, the individual going to treatment, making gains and the family staying behind, being able to move through that with the family member is really the best way to build a base to ensure the future of the relationship.
So we certainly recognize how important it is we understand that this disease of addiction is a family illness, and the family needs to work together to get through it. And the family program is just a wonderful addition to the services that we offer, and hopefully more people continue to take advantage of it. And if you want more information on the family program, you can check our website at meridiancommunitycare.org. Thanks, Phil.
Thank you.